Rick, who is going to be talking about back pain and sciatica. He's a physiotherapist, and he's going to give us an understanding of the root cause of back pain and sciatica, as he's very passionate about helping people to live a pain-free life so they can be their true selves and have a full life.
Mm.
I think it's a very, very important subject because many people are suffering from issues with their backs as well as the sciatica. Thank you so much for your time to being here with us, Rick. How are you today?
Yeah, thank you very much, Angelica. I'm really good and glad to be on your show.
So tell us a little bit more about, what are the kind of the issues that people, like the symptoms that people come at you for, mostly around, the back pain.
Right. So people come in to see me often after they've been told that they need to rely on medication, injection, or even surgery to get rid of their back pain. And a lot of them have been seeing multiple different types of practitioners, like physio, chiro, acupuncturists, etc., and many doctors before they come to see me for a different opinion.
Okay. So by the time they come to you, they're kind of like desperate. They have tried everything. They have, and they still have a lot of pain, right?
Yeah, that's usually the case.
Yeah. So does that mean that they have had an injury as such, or could back pain just come up out of nowhere? Or like what do you see like being kind of the maybe 2 to 3 main causes of people actually starting to get the back pain?
I would say over 90% of the time, back pain is we call an accumulative strain injury. Okay? It doesn't just happen overnight. Okay, it's usually the little thing that we do day in and day out, and then that really accumulates in a particular point in the body. And so often our habit or our work posture, for example, is sustained posture and repetitive movements are the two main causes of any injury in the body, back pain as well. So if you stay in one position for too long at the computer, it's very common. It's a very common cause. Or if you bending, twisting a lot, or you walk a lot, all those repetitive movement can also cause back pain.
Yeah. So the people that are coming to you, are they, when you look at their health status, like, does that mean that, they're mainly kind of working in the office or doing some repetitive work? Like it could be like, a trades as well, like you're just bending and lifting and things like that.
Yeah.
What would you say kind of it's most likely, for people to kind of fit in a box kind of thing?
Right. Yes. So our body seek for homeostasis or balance. Okay. So too little activity or too much activity on the other extreme, they can both cause problem or imbalance.
Yeah.
And pain is a feedback that the body gives to alert us that we are not in balance.
Yeah.
Okay. So for example, if you sit in the office for a long time every day, one common advice I give to my patient is you need to walk 6,000 steps a day.
Yeah.
Okay. So they have too little activity, so they need more activity. Okay. On the other hand, for someone who does quite a laboring task, walk a lot, my advice is for them to rest. Okay.
Yeah.
So the body needs to be in that balance.
Yeah. This is really interesting because I think that there is also an issue these days of over exercising, right? If you're also over exercising and doing lots of weights and doing straining your body all the time, and what are your thoughts around that as well?
Oh, definitely, definitely. We have a lot of gym goers, gym junkies
Mm-hmm.
who are overexerted themselves,
Yeah.
and you know, it's usually from repetition. From
Mm-hmm.
repetition. Of course, back to the question you asked. So, what's the most common cause? I said 90% of the time is a cumulative strain injury. There are
Yeah.
small minority who have trauma. The big
Okay.
traumatic event, for example, being hit by a car or um, suddenly lift something too heavy, unexpected.
Mm-hmm.
That can also lead to injury, but the
Mm-hmm.
majority of the time is a cumulative strain injury, 90% of the time. Yeah,
Yeah.
so it could be accumulate a lot of stress, okay, and the body has a threshold. It can cope up to a
Mm-hmm.
certain level, and then all of a sudden you do very trivial things such as just bending down to pick up a $50 note from the floor,
Yes.
and and all of a sudden that $50 note becomes so heavy that
Yeah.
your back went out. So it's not that sudden bending that caused the problem. It's usually the accumulation of this injury, okay, and then
Yeah.
that bending action was just like the last straw that killed the camel.
Yeah.
Yeah.
Yeah. And a lot of people, that happens with a lot of people, right? They say like, "Oh, I injured my back, getting out of bed," and you're like,
Mm.
"How did that happen?" But it wasn't that, wasn't it? It's the kind of the accumulation of what they have been doing their whole lives.
Correct. So, when you lie in the bed, you actually spend a long time in a still position. It is very similar to sitting at the office,
Mm-hmm.
for a long period of time. So that sustained posture can cause strain to the body.
Yeah.
Mm.
Yeah.
And all of a sudden, you move quickly. Getting out of the bed can be the last straw that kills the camel.
Yeah. So I experienced, not myself, but my husband, which is somebody well, of course very close to me, sciatica crisis last year, and it was incredible to see what happened in the whole process.
Mm.
My husband is very fit, like we exercise, not over exercise, but we eat healthily, we exercise every day, and but he does work, with it's a very physical job that he
Mm.
does,
Mm.
and and then he had this sciatica crisis, which took him to the hospital, and no pain medication was able to help him. And
Mm.
you're probably are very familiar with this scenario,
Yep.
and what happens. I'm very fascinated about the whole the connection between when that pain starts happening in the body. It's almost that feedback loop keeps happening over and over again, and people are taking those opioids,
Mm.
which they did explain to him, like, you can't be taking this for too long because they
Mm.
are addictive.
No.
Like, how do you we're very fortunate that my husband got back into on top of what happened, with everything that we kind of know what to do naturally. But his state of health was, at the start, was good, and I know that a lot of people, when they have something like that, their state of health, it's not very good, so they are
Yes.
already overweight, they're already taking medication for other things, and
Mm.
they're not exercising, they're eating an unhealthy diet, and once this feedback loop happens with the pain, like, how tell us a little bit about, if somebody's at home suffering now with so much pain, and they just feel like, there is nothing I can do about this.
Right. Okay. Um, I think that there are a lot of issues here we can talk about.
Yeah.
Yeah. Number one is taking medication, like strong medication, opioids for pain. All right. So first, we need to understand what's the function of pain. The pain is a warning that there is a threat or injury in the body.
Hmm.
Okay. So it is a bit like police. Okay. So if there is a car accident in a busy traffic intersection, police would come to the scene to redirect the traffic until the scene is cleared, right? If we remove the police before we clear the scene, before we clear the car accident, okay, what would happen to the traffic?
Yeah,
It
just
becomes
chaos.
more chaotic. Yeah, more chaos. So, and then sooner or later you will need more police, isn't it? So similarly, so if there is an injury in the body, okay, pain will come, and then if we just take pain medication
to numb,
to numb the pain without addressing the real cause, then sooner or later there will be more injury and therefore more pain. Okay, so it is very unwise to rely on medication for back pain or any pain in the body. Okay, we really need to find out the cause, okay, and address it. Once we address the cause, then there is no need for the body to create a warning, and therefore no pain. Okay, so that's the number one thing. Medication is definitely not the right solution for back pain or any pain in the body. Okay. Number two, the real cause of back pain. This is probably the key message I wanted to that the audience know. The real cause of back pain is often not in the lower back.
Yeah.
Very counterintuitive, because when you go every day I have patients who come to see me with their MRI scan. The MRI scan clearly show there is a bulging disc.
Yes.
Okay.
Yeah.
In the lower back.
Yeah.
Okay? But the thing is, over 90% of the time, we can improve their condition dramatically and very quickly. Okay, often even without touching their lower back. Okay, so that means, so when we check the whole body, often the real cause of the, we can find some, maybe say in the shoulder or down in the leg, in the calf muscle, a really, really tight spot. And once we release that with our hands, guess what? Their movement becomes a lot better, and their back pain also reduced dramatically. Yeah. So what I'm trying to say.
So basically the body's been compensating, because that tight, what people don't realize is that the body's a whole thing, isn't it? Like, it's not just that little bit of the back, the bulging disc. Is that if there is one thing that is not working properly, your body's going to keep compensating, which is going to potentially cause the lower back issue, right?
Correct. But the trouble is, when you go to see any practitioner, usually they'll just be focusing on treating the lower back where the pain is. Okay. So they don't get significant improvement. Angelica, is it possible that I show you some slides on the...
Yes, yeah, of course, yeah.
So if I share screen here, entire screen. Okay, share. I'm not sure if how to. Okay, share screen. Okay, can you see my slides here?
Yeah.
Yep. Okay, let me show you. So every day, this is what I was saying. Every day.
So I can see our own live stream, but I think you need to move the table to your actual slides.
To my actual slides. Let me see.
Yeah.
Can you see my PowerPoint slide?
I can't see the PowerPoint slide.
PowerPoint slide. Okay, that's fine.
No.
Stop sharing. I'll come back. Yep.
Yeah.
Share screen again. It's Chrome tab.
It's just like the tab. I can see the tab with us, but I can't see the actual tab with the PowerPoint. So I'm sorry about this, everyone, but just bear with us. I think it's always good to have a visual.
Can you
Oh, yeah,
see
that's it
now?
now.
Okay.
Yeah.
Yep.
Yeah.
So every day we have patients come in to see
Yeah.
us with a MRI like this,
Yeah,
and
which is
90%
exactly
of,
what happened to my husband. Yeah.
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 Well, I can tell you 90% of the time this is just a normal aging process. As we get older, as we get over 35 years old, we start to get some change in our disc, and you start to get this kind of pictures. It's a lot of the time it's just a normal aging process, pretty similar to we grow gray hair as we get older. But the thing is, when you go to see a doctor with your low back pain, doctors usually just refer you to get a scan, and then when the scan comes back, it is very convenient for the doctor to point out to the scan and say to you, say, this is the cause of your back pain.
Yeah.
But the thing is, if this was the cause of the back pain, then what's the treatment? You can only maybe take medication to dull the pain, or you take a injection or surgery. But the thing is, if the real cause of back pain is not here, not in the lower back, okay, say if the real cause of back pain was in your leg, then an operation here, how much is going to help?
Yeah.
Not much, probably make it worse. So we need to look at the whole body holistically, not just the area of pain, in order to achieve consistently good result. So I can show you like a few examples here. Like this lady, she's got back pain and couldn't walk. And I actually treated her calf muscle, and she could bend down a lot further. This lady's got really bad back pain, and she's seen many practitioners, including specialists who prescribe antidepressant for her pain. Imagine
it gets to the point,
especially
point
if
you just
if you can only walk for 10 minutes and you have 5 children to look after. I treated her hip muscle, her hip, and she was able, after a course of treatment, she was able to fly down to Melbourne and walk 5 blocks shopping. She was really happy. Yeah. See, and then this gentleman here, 55-year-old warehouse laborer, he couldn't bend, and
that's incredible.
I treated his shoulder, and he was able to bend down and touch the floor. So you can see there are different cases. There are 3 cases. They all have the same symptoms, back pain, but different cause. Okay, case 1, the cause was in the calf. Case 2, the cause was in the hip. Case 3, the cause was in the shoulder. So they have same symptoms, but different causes.
Yeah.
So you don't just look at the back. Okay. Very rarely the real cause was in the back. Yeah.
So with this your patients, so they come in and you kind of release the muscle. Do you send them home with some homework? Because I truly believe that, of course, there is a lot of people that also believe that going to the physiotherapist, you have to solve all their problems without them changing anything in their life. So if they go back to sitting down with hours a day, not walking their 6,000 steps, eating on a healthy diet and all of that, the issue, what are your thoughts around that?
Okay. Yeah. Yes, physios should prescribe exercise to the patient, but if the cause, let's say the most common exercise that physio prescribe is usually around the lower back, to target the lower back. But the thing is, for example, case 1 here, with her back pain, the cause was in her calf muscle. So the treatment or the exercise we prescribe should be targeting at the cause, that is the calf muscle.
Yeah.
Okay. The second one, same symptom in the back, but the cause was in the hip. So the treatment or the exercise should be directed to the cause, hip. Okay.
Yeah.
And the third one, even though the same back pain, the cause was in the shoulder, so the exercise should be targeting at the shoulder. So if you just prescribe exercise to the lower back, it won't really help for any of these three patients.
Yeah.
Okay, so it is very important that we can identify where the real cause is.
Yeah.
And then prescribe the exercise accordingly.
Yeah.
Not just some generic exercises.
Yeah. And how, for example, like let's say the case one, how long will it take? And I can understand that probably it's like depends case by case. It depends on case by case, but how long do people need to, come back to see you and do the exercise at the same time to actually, solve the issue?
See, we actually run back pain and sciatica workshop here every month in our clinic. And then usually around 20, 30 people will turn up. And then we have patients who have had a long-term problem, like 10 years to come. They come 10-year problem. They've been to everywhere, seen many practitioners before they come to the workshop. And we do demonstration. We call it 5 minutes miracle in the inverted comma. So we do a live demonstration in front of the audience. And like over 90% of the time, we can significantly or dramatically improve their movement and reduce their pain in less than 5 minutes.
Wow.
Less than 5 minutes. And we can get this consistent level for the result. And I can tell you a lot of the time, we don't even touch their lower back. I think the reason people don't get results because the treatment was not directed towards the right cause. Okay, so how many sessions does it take to achieve their goal? We have 3 phases of treatments. We call original point therapy. There are 3 phases. Phase 1 is to diagnose correctly, diagnose where the real cause is. Okay, and then you take 1 or 2 sessions to diagnose correctly. Then after we diagnose, then we need to address or fix the cause. Okay, everyone is different, but on average, 6 sessions for them to achieve their goals.
Yeah.
Okay, everyone is different, but on average, 6 sessions. And then after they achieve their goals, then it's like taking your car for a service every now and then. You need the patient to come back once in a while for a checkup to make sure that it's not aggravated again. So how often do we need to check up? It really depends on every individual's case by case. Some people they come in for a checkup every fortnightly, some people every month, some people every 3 months. So everyone is different. The more diligent they are with their exercise and looking after their posture, the less frequent we need to see them.
Yeah. And within that, and I really like that, like on the fixed phase, you teach strategies for the client for self-care. How important do you think it is for the client to actually take the responsibility for the self-care part?
Yeah, of course, it's very important. It's like you go to see a dentist and they clean your teeth, but you still need to go home and brush your teeth. You can't just rely on the dentist to look after your teeth. Same thing. We number one, we need to find out where the real cause is. Once we find out the real cause, then we can prescribe the right exercise for the individual, and then they need to have the level of posture awareness, adopt the right posture. Okay, so the with self-care, so with brush your teeth, you probably just want to spend up to 2-3 minutes to brush your teeth. You don't want to spend like 20 minutes, 30 minutes to brush your teeth.
Yeah.
It's not practical. So with our exercise, we try to, only a patient only needs to spend 1 minute, 2 minutes to do the exercise. So there's no need to prescribe like 10, 20 exercises to the patient, and then they need to spend like half an hour, 1 hour a day to do the exercise. That's just not practical. So we want to do, if we can pinpoint one specific course, okay, and then just do one specific exercise for the problem, okay, and I think that is a very good result for the client.
Yeah, amazing. Can you talk us through like an incredible case, maybe somebody that came in that, had been taking, medication for, years on end, and, they felt like lost and depressed and
this one classical. This man, when I saw him, he was 35 years old.
Yeah.
Okay. And he said for 10 years, from 25 years old to 35 years old, this photo on the left is all he could bend. He was stuck in that position for 10 years. And that was the prime time of his life.
That's crazy. That's young.
Yeah. And he's seen so many doctors, many different practitioners. He took so many medications. And the effect of medication really made him look like a drug addict. Okay. And we did a quick examination on him and found that the shoulder, this point here, was so tight, and we treated immediately. He was able to bend down and almost touch his ankle. Okay. Jeez. So imagine, and he cried. He is a man, and he cried. He said, I can't believe what happened. Okay. So I feel like I can see a hope, but at the same time, it was like 10 years of my best time in life was wasted. Okay. And it's just because everyone was trying to treat him, try to treat his lower back, but no one has looked at the whole body holistically. So just a simple, very simple treatment to his shoulder, he was able to bend down so much. So that was a very, very classical case. And I can tell you, cases like this happens here every day. Okay, we have so many patients who has given up their hope and would hardly move, and we just need to diagnose them correctly. So no assumption. Look at the whole body. Okay.
Yes.
Don't just believe on the scan, the fine scan, or don't just use medication to treat your back pain.
Yeah. That's incredible. And like I said, there is a lot of people in the same position as this man that you're giving the example here. They've been taking medication, they've lost hope, and it's incredible. Like I said, once you're diagnosed, which probably that bit of his body was not even on the scan, right? Do you know what I mean? Like, so it's not even on the scan. So it's really understanding where the root cause is, so you can address it correctly from the beginning.
Exactly. So I think.
So how do people? Yeah, go on.
Yeah, so our purpose is to help people pain-free without medication, injection, or surgery. So over my 20-odd years of practice, we've seen so many unnecessary surgery happened, and often the patients got worse after the surgery. So that's why I wanted to get this message out to as many people as possible. Don't just treat the lower back; look at the whole body.
Yeah. I mean, my husband did have a cortisol injection, unfortunately, and it did not work. So clearly on the, at that time, the CT result showed that the sciatica on one side was at least triple the size, and he felt a relief for 48 hours, and then he went back to having pain again. So it wasn't until, like I said, he treated the root cause. So I think that's definitely a message of hope and a message that people need to hear more, because there are so many people suffering from it, for sure. And so how can people reach out to you? And you mentioned that you do those free workshops as well. Like, if you could tell us a little bit more about that.
Yeah. So every month we run a workshop. It's free to the community.
Yeah.
And it happens usually on the third Wednesday of the month, except like next month, August day, because of the 𝗕𝗢𝗚 holiday. So it's gonna be the week after. So I think it's the next one will be the 23rd of August, 7 o'clock in the evening. Yeah.
Okay.
So yeah, that's the best place to come in and talk to me, see me do a demonstration in front of the audience, and then I'll go through the theory behind what we do and how we can achieve this consistent result. We make sure it's very easy to understand. I'll show you our research findings and some live case examples, and then what is original points, treatment, therapy, answer your questions. Yeah.
Amazing.
We also talk about headache and migraine, neck pain. Yeah, in the workshop as well. And then you actually get you get discount treatment sessions if you turn up to the workshop.
Amazing.
So yeah, so make sure you use this opportunity to come and see us. Alternatively, you can find out more about us on our website, so 𝗕𝗢𝗪physio.com.
Yeah, I'll add the links, the details below, and I'll add the details of the free workshop as well. I think that's great. Yeah, so people can reach out to you.
Yeah, that's good.
Yeah, that's awesome. Well, thank you so much for sharing your knowledge here. I think that's very, very, it's very an important subject that is affecting so many people. I think there is a lot of people go to the GP these days just because they are they've got lower back pain, and from that on, it just becomes a cascade of, health professional visits without getting any real answers.
Yeah, it's going around in circles. It makes you go around in circles.
Yeah, and like I said, medication is not a long-term solution. Until you get to the root cause, it becomes quite difficult to solve an issue for the long term.
You know what? When you go around in circle and still can't find the answer, the brain actually becomes more alerted. Okay, and then it may develop more widespread pain, and eventually you get this kind of label: fibromyalgia, chronic fatigue syndrome. So these are often it's a cop-out turn. I can tell you, a cop-out turn, because the doctors can't really find out where the cause is, and then give you this label. And once people believe, put label on themselves, it really affects their function big time, affect their life.
Yeah. Yeah. I'm a firm believer that, when you have some sort of, disease or issue or physical, it's very important that, you surround yourself with hope and positive stories, because there's always somebody out there that have been kind of similar or the same situation as you, and they have conquered whatever you have. And like I said, labels can be quite damaging, because it becomes part of your identity if you're not careful. And you and the more you believe in that, the more kind of deep in that hole you go to. So
that's right.
So that's thank you so much for highlighting that, because I think that's also an important point for people to realize and to kind of take full responsibility and just seek the right answers.
Yeah, thank you very much, Angelica, for providing this opportunity so that I can share this information with more people.
Yeah, definitely. Thank you so much for your time.
Thank you very much.
Thank you so much. Take care.